Alright, today I'm going to be demonstrating how to do a wet to moist dressing change with irrigation and a culture. And so the first thing I'm going to be doing is I'm going to be at the nurse's station, and I'm going to pull up my chart. And so I've got Tammy Holt, and her date of birth is 3/2 of 1963. She's allergic to codeine. She has got diabetes, COPD, and then she also has had an abdominal surgery, an open incision. And so I'm going to go ahead and check my doctor's orders. And my orders say wet to moist dressing change to the abdomen daily and PRN, okay? And it says to irrigate with 100 mils of normal saline and obtain a culture with today's dressing change to the abdomen. And the order is for today's date, so we know we're going to need to irrigate and also do the culture. Now, the wet to moist dressing change, of course, that's the reason why we're going to be doing the dressing change, but it says PRN. So that would mean, you know, if our patient has a lot of drainage and the dressing is getting overly moist, then we would need to change that more frequently. But as it is, it's daily, and then also PRN, okay? And so we've got the doctor's orders. We have looked at the policy and procedure. I'm looking in my medical chart to see if there's anything else in this, like for example, if my patient had any problems with positioning, because we're going to need to position the patient up just a little bit because we're going to irrigate. Do they have tubes and drains that we've got to be watch out for, so that as we're positioning that we're not pulling on those tubes or accidentally de-seeing them. So we'll be looking for all of that in the chart. I'm also going to be how does my patient learn, because they may be going home. So can my patient, it's going to be a little difficult for them to do, so maybe their family, how do they learn, because we're going to teach all the way through this. And so so we've identified why we need to do the wound care. Of course, it's ordered, and then if it's PRN, what we're looking for that. I'm also going to be looking to see, you know, has my patient been pre-medicated beforehand based on the pain level? Can we use any non-pharmacological methods for the pain, such as having them do some deep breathing, some different alternative stuff? Or are we going to need to give them pain medication? And if that's so, then we need to make sure we give it plenty of time based on the route to take effect for our patient on that. Also, we're going to make sure that because we're going to be doing irrigation, we need to make sure we have the proper PPE, which in this case we need to make sure we have a mask with a face shield. And if we thought we were going to splash our gown or our clothing, we could use an impervious gown on that. But we've already determined that we really just need a mask and face shield on that. So once I've done that, I'm going to go ahead and close down my computer at the nurse's station, and I'm going to go to the supply room. Okay. So when I go into the supply room, I'm going to be getting my supplies ready, and so I'll have my mask, and we're going to be doing the irrigation. So I've got a blue pad, I got my Emerson basin to kind of put that to help collect that. I've got several CPAs because I'm going to use those to measure the depth and then also to help me with my packing. And so with each one of these, I need to make sure I check the integrity of them, because it says that sterile in unopened, undamaged package, single patient use. So I'm going to check all of my packages to make sure that they all look like they have not been, they're intact, okay? Since I'm doing an irrigation, I've got my irrigation tray, again, checking to see if it has any expiration dates on it and if the tray is intact. So this is a brand new one. I've also got some skin, and when I go in, I'm gonna ask my patient if they have any allergies to skin prep or anything like that. But this is just alcohol, but then there is also adhesive remover that we could use when we get ready to take off the adhesion. We're also going to be doing a culture, so again, making sure this is intact. This one does have an expiration date, so I've checked that expiration date. It's within the expiration date. The packaging is packed. I'm going to go ahead and take in 2 just because, in case I contaminate one. And so this, check that expiration date, check the packaging. I'll also need a biohazardous bag to put that culture in whenever we, after we've taken it. And then I'll also need to get the prerequisite or the order, the unit secretary will print off the patient's name, date of birth, all of the information, and I'll need that label to apply to my culture, and then I will need to put the date, time, and initials in the location of where I got that, okay? And so I also have sterile gloves, again, making sure the expiration date is good on each one of these, and it is, and the packages is intact. I've got some ABDs. We'll need 1, but I'm going to take 2 just in case, and I can leave that in there. Again, checking this one says sterile and unopened, undamaged package. And so I've got 2 of those. Their packages is intact. And then some 4x4s. I'm going to need, based on how many, looking at my chart as well, how many 4x4s I might need to clean and dry with, and then making sure that I've got enough to pack with, and then also to 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So I'm probably going to need 3 of these for drying and cleaning, and then I'm going to need 1 for the packing. So I've checked all of those based on, and also, you know, how much how much I need to put down as the bottom layer with that. Okay. Also, I've gotten it just says to irrigate, and so per policy and procedure, normally we're going to irrigate with 0.9% sodium chloride, and so I've got a 0.9% sodium chloride. This is irrigation, and so it says 100 mils. That didn't specifically say. Sometimes it will say irrigate with 100 mils, or it may, oh, this one actually did. It said irrigate with 100 mils. So I do need to irrigate with this 100 mils. And then also checking the expiration date, making sure this is intact, making sure it's a brand new bottle. And then afterwards, whenever I do, since it's 100 mils, then I can just throw this one in the trash. This one will be used to help with the cleaning. Again, it's the normal saline. And checking the expiration date on it, and also checking to make sure this is a brand new one. So if it was a used, and after I've used it from brand new, I need a date, time, and initial it. And then after I've used it, if it's a used bottle, it's already in the patient's room, I would check the date, time, and initials. The expiration date, time, and initials, make sure it's within the 24 hours. Per policy, it's usually good for 24 hours. If not, then I would have to take another one in, okay? I've got my paper tape, just some extra stuff here. And so I'm gonna go ahead and gather all of this that I've checked all of this with. Hard to get all my stuff here. Okay, so we're going to leave the supply room, and I'm going to go to my patient's room, Knock, knock, knock. Good morning. My name is Jan Buckskemper. I'm a registered nurse. I'm going to go ahead and do my medical hand wash. I'm going to put my supplies down on a clean, dry surface here. And I'm going to go ahead and pull up my computer, okay? Can you tell me your name and date of birth? Okay, Tammy Holt, date of birth 3/2/63, and date of birth, or Tammy Holt, date of birth 3/2/63, 1963. Yes, that matches. And medical record 54321, medical record 54321. And are you allergic to any kind of medications, Ms. Holt? To codeine? Okay, and what does codeine do to you? Okay, kind of gives you a rash, all right. And so we're not going to be doing any of that today. We are going to be, the doctor has ordered us to change that dressing on your abdomen. Now, so we've talked about medications. Are you allergic to any kind of skin, any kind of tape or any kind of cleaning solutions? We're just going to be using normal saline today, so everybody should not be allergic to that. But do you have any of those? Okay. And then are you in any kind of pain? On a pain scale of 0 to 10, 0 being no pain, 10 being the most pain, how would you describe your pain? 0? Okay, that's good. And I'm going to need to get me a new mask, okay? So no pain? All right. Now, if during the procedure you start having any pain, just let me know. We'll kind of do some breathing exercises if that's the case. But you haven't had any problems with us doing the dressing change and needing any pain medications? Okay. All right. Well, good. All right. So, so we've identified our patients. We've checked the order again. We're going to be doing a wet to moist dressing change to the abdomen this morning. And the doctor wants us to irrigate it with normal saline, and then we're going to get a culture with this as well, okay? So I'm going to go ahead and I've done my medical hand wash when I walked into the room, and I'm going to go ahead and put on some clean gloves. Because we're going to be doing irrigation, okay, I'm going to just go in and make sure I've provided for privacy, okay? Asked anybody to step out, or if there's going to be someone that's going to be helping you with, we'll go ahead and start teaching them about this. So I'm just going to be uncovering, making sure I've got your gown down here, and again, we're just going to be providing privacy, okay? And so before I actually do that, I already had someone come in and help me position my patient, and so we have got them rolled up just a little bit. I had someone put a pillow underneath there so that they're kind of tilted this way, so the irrigation solution runs this way. Normally would have them a little bit more tilted, but for you to be able to see what's going on, we had that right there, okay? So once, and I can get my patient to put their hand up here, if it's not, and see if they can keep it up there while we do this procedure. That package is still intact, so as we were positioning, we were making sure that we didn't have any tubes or any kind of drains or anything like that. So I'm going to make sure we get that up underneath, because that way, and we could actually, there should be already one underneath them, but this is just an added extra pad there, so that when we start irrigating, that solution will drain mostly into our container there. Okay. All right, so I'm going to go ahead, and now that we've done that, if I need to, I'm going to go ahead and take these gloves off, because I've been touching everything before I go, and so glove to glove, skin to skin. I'm going to do my medical hand wash. and put on new clean gloves. So and before I do that, I'm going to go ahead and walk around and get those 4x4s that I dropped. Okay. And so I'm going to check the bottom was what, and so it's still intact, so we're still good with that. And I'll make sure I clean and dry my table. So pick that up. I'm going to go ahead and do another medical hand wash. Get the stuff I need here to begin with. And I've got my biohazardous bag in my trash down here. And I'm going to use my alcohol swabs to help take out or the skin prep. Take this and just lightly rub on the tape itself. That kind of helps with the adhesion. And so kind of using that push-pull, we're going to push-pull here, okay, as we're loosening this up all the way around, okay, making sure it's not moving around a bunch. So the push-pull, loosening it up, okay. Once I get that all done, I'm going to go ahead and take out my dressing. Okay, and I still have part of the dressing in there, so I'm going to look at the color, odor, amount, and the consistency here, because I'll need to document that as well. And so I'm going to go ahead and glove to glove, skin to skin. We're going to do a medical hand wash, and I'm going to go ahead and put, since that didn't come out with my when I picked the dressing up, and I'm going to go ahead and get now you could put some sterile gloves on, because I don't want to reach in there with so I'm going to actually use a CTA to kind of help with that. Because you don't want to reach down in there with these clean gloves, because we want to do this a sterile procedure. So I'm going to use my CTAs. Okay, making sure that the tip right here is what I want to be sterile, and so making sure I'm not going to be injuring my patient. Go ahead and set that down, because that part of that is. And I'm just going to go ahead and lift, take some of that out without touching my wound. Go ahead and take that out. We're going to be looking at the drainage as well in there. And so we can document that. Glove to glove, skin to skin. And then do another medical hand wash. So, you know, sometimes the dressing and the packing will come out together. But if it isn't, and I could have put sterile gloves on, reached in there, but I used a sterile CTA to help me get that out. Now, if this is wet to moist, okay, because we want the dressing to stay moist so that it keeps the wound bed itself moist. And hopefully, if that had been stuck, then I would have had to get some sterile gloves on to make sure to take that out. Okay, so now that I have that out, I'm going to go ahead and put on another, I washed my hands, I'm going to go ahead and put on another pair of clean gloves. And I'm just staying right here within my patient's, because the bed is up, and I know that my patient is cooperative, and so if my patient wasn't going to be cooperative, I would have had extra people in here to help me. So as we're moving around, getting clean gloves, I would need to lower and raise the bed, but my patient is, and I've just been right here. So now I'm going to go ahead and get another CTA. And we're going to measure without, that one's not going to. Your CTAs, if not, you would have to have a measuring device, but my CTAs have the centimeters on here because you measure in centimeters. So I'm going to start without touching the wound, okay? Kind of noting where, because this one isn't as long, so and then I'm going to move it down, okay, to where it starts here. So this one is 14 centimeters in length. And then I need to, again, I'm not leaning over my wound, but I'm going to check. So the width down here is 0.5. Sorry, that's 1 centimeter. The length, this is 2.5. And then we've got 0.4, okay? So I'm going to go ahead and write those down, okay? So my length was 14 centimeters. The top width was 1 centimeter. The mid was 2.5 centimeters, and then the bottom, which is the distal, so we've got the proximal, middle, and the distal, was 0.5 mils. Make sure of that. That's what I said. 0.5, okay? 1, 2, 3, 4. Okay, so, because I'll need to document that here in just a little bit. Okay, and then the depth, so I'm going to be looking at the depth, and I'm going to be looking at the anterior, or the proximal, the middle, and the distal. Okay, so what I need to maintain is the actual CTA itself to be sterile, okay? And so I'm going to go ahead and take this out. We're going to go to the deepest part first, and I'm going to slide my glove down without touching the patient, kind of get it eye level, okay? And we're going to take that and we're going to measure that, okay? That's 3 centimeters. I'm going to look at the next deepest part, and I'm going to slide my finger down, making sure I don't touch the wound. So I had 3 centimeters. I've got 2.5 centimeters, and then the last one. Now, I'm taking a culture, so I would need to also look at that, because it's the red part down here is where it looks like it might be getting infected, so that's where we're going to need to do the culture. So as I'm measuring, I want to make sure that I do that last, even if maybe it was the deeper. If that's the case, I would need to change out my CTA, okay? And so making sure again, and I'm going to, that's 1.5. So 3, 2.5, and 1.5, okay? And I'm going to go ahead and get rid of this. Oh no, I'm going to keep that because we still have irrigation. Okay, all right. Glove to glove, skin to skin. Again, do my medical hand wash. And I'm going to document my depth. That was 2.5, 3, and then 1.5. Okay, so I'll need that for my documentation. Okay, so now I'm going to go ahead, and as long as my patient is still comfortable, I'm going to be doing the irrigation. So now I'm going to go ahead and put my mask on with the eye shield, turning around. Make sure I squeeze the nose, pull it down and around. Okay, if you have glasses, make sure you get that up underneath there, because the fogging. Okay, and I'm going to go ahead and set my field up. I like to set my field up with the things that I'm going to be using first. So again, this is intact, and I'm going to put this the furthest. Now you notice I've got my table kind of at an angle. So as I'm cleaning and drying and packing, and I usually keep 1 foot towards my sterile field so that I can still see, kind of like a wide angle camera, that I can still see my sterile supplies. So I'm going to go ahead and open. Okay. Open away. Making sure that doesn't flop back on itself. And then I'm going to go ahead and open up my 4x4s. Again, I've already checked all of these and making sure I will open them up away from myself. And we determined that we were probably going to need 3 4x4s because of the amount of okay. Making sure we're not crossing over, opening it away, making sure our fingers do not cross into as we're sliding these on, okay? And I'm just going to move these back over here for just a second. I need a couple of those. Okay. I need my gloves here in just a second. I'll need that here in a little bit. Okay, so I'm going to go ahead and making sure I'm not reaching over. I'll use that for my deal here. Okay. Don't need this just right now, so I'll put that back over here. And I'm going to go ahead and kind of stagger these. I'm going to go ahead and get my culture tube open. Again, we've already checked all the integrity of these. Okay. And I'll open some of those here in just a little bit. And then, so, already checked these. Brand new bottle on the label, okay? Sealed, okay? We're gonna lip a little bit, and then I'm gonna go ahead and we're gonna pour. So I'm gonna pour into this one right here just enough to go over. Okay, make sure my is moist. Okay, and then and you saw I kept my lid up and within sight. Go ahead and do that, and then I'm gonna get my pen. And because this was brand new, I need to date, time, and initial it. So if I check it tomorrow, so I'm going to go ahead and put that over here. Okay. So I've got 2 that are dry, 1 that is wet. Okay. And then I also need to open up my. So I'm going to open this up. I'm going to take this out. Now what I need sterile is on the inside. Okay. I'm going to look at. Which one has the 100 on there, which I know I've got 100 in here. Okay, and I'm going to go ahead and take this loose. Okay. Make sure I don't cross over that. Take this out. Since this is brand new, I don't have to lip it, but I need that whole 100. So making sure just over the top here, palming the label so that we don't obstruct it. Okay, so that's the 100 that I'm going to need. And since I use this whole thing, I can just go ahead and put that in the trash there. Okay, and I'm going to be using that here shortly. So I'm going to go ahead and do a medical hand wash. And I could have set everything up, then put my mask on, because, you know, it gets hot and it starts. And so I've got my sterile field, so I've got to make sure that I'm keeping my sterile field inside the whole time. Okay, so I'm going to go ahead and take and pull up my solution. okay? I'm going to take this out, okay? Put that, okay? And so I'm pulling that solution up, don't actually pull it up. And so I've got my solution in there, and I'm going to come over, and because my patient's a little bit more lateral, but so you can see better, we're going to start at the distal, and I'm going to irrigate the distal, kind of working down the distal from me, okay, which is the left side for the patient wound bed, and then I'm going to work towards this direction right here, okay? So as I was measuring the depth, after I took the dressing off, I'm also going to be looking at the wound bed itself. Does it have granulation tissue? Does it have necrotic tissue? Is there slough material in there? Of course, we were already looking at the drainage. So I'm looking at the wound bed, but I'm also going to look at the surrounding tissue as well. Does it look like the skin itself is staying too moist, like this one has red area around it? So is that normal, or is that irritation? And so in that case, we'd also be measuring that as well. So not only the wound bed, but the surrounding tissue as well. So again, we're going to start at the distal, kind of working our way back and forth to this part, and it should be running down into our deal here. So we want to use enough force that we're using this cleaning, but yet we don't want to use so much force that, because what happens with the tissue is, and I just, far side kind of coming down the middle, so it's kind of flushing it out this direction, okay? Don't want to use too much force, because the granulation tissue, we want it, it's closing from the inside out, and that granulation tissue is still real delicate, so we don't want to use so much force that we tear that apart and kind of start over. Okay, so I'm already making sure I didn't cross over my 4x4s. And if I felt like I did, then I would have to get brand new ones, okay? So I'm going to put that back over here. And I'm going to take this and then kind of clean our patient, because we're going to probably clean that later. Put that in there. I'm going to do a glove to glove, skin to skin. We're going to do a medical hand wash. And I'm not too sure if I crossed over that when I brought that back over here, so I'm going to go ahead and take this one, and we're going to dispose of it. Get someone to bring me a new one, or I brought extra in here, so this is a brand new one. And go ahead and open that up. Slide that back in. Okay, and so now I'm ready to go ahead and put my sterile gloves on and start cleaning. Okay, so this will be my first pair of sterile gloves. Move that in, making sure that doesn't contaminate. Okay, you saw me reaching underneath, but I don't have my sterile gloves on. When I get my sterile gloves on, I want to make sure, and even when I was lipping, that it's above the table level, not going down below. Make sure I'm not crossing over, so that doesn't flip back on itself. And then I'm going to pick this one up. Okay, step back. This is the part that's going next to my skin. Get up here so make sure you can see what I'm doing here. Make sure I don't rip my gloves, okay? Make sure you're not touching that 1-inch border there, okay? Come back over here. This is sterile to sterile, glove to glove. So I'm going to pick it up. Once I've got this on, I'm going to go ahead and get the gloved thumb up. Okay, check the integrity of my gloves. Okay, and now I'm going to go ahead and start cleaning. Okay, so I'm going to grab, making sure this, and we're going to squeeze out that excess. Okay, I've already put it together, and I'm going to transfer without touching. And now this hand, I want to make sure it doesn't come in contact with anything but just the skin. So because we identified the bottom part as the part that might have the infection, so we're going to go to the inside, trying to make sure that we, okay, go all the way up. I'm going to get sure I don't drop my hands down below. So I went to the middle of the wound and went up. Transfer without touching. Okay, I'm going to go to the middle of the wound and go down. I'm going to go to the right next to the incision on the surface and the middle up. Okay, middle down, making sure that my glove is the only thing that's crossing over the wound, and then I'm going to do the middle nearest up. And then I'm going to do the down. And then we're going to continue to kind of work our way out. So I'm going to do a little bit further out, up. Making sure my glove is the only thing, and just a little bit further out, middle down. Okay, I picked up 2 here. So I'm going to go ahead and separate those. Actually, I'm not going to worry about it. So I'm going to go ahead and transfer, come out, because I'm going to do the near part. And I'm going to take one of these, making sure it's not touching the edges as I take that out. Okay, because there's 10 in here. Stick that in there because it's still, the container is still, and I've still got moisture in here. Okay, and I'm going to do the far side out here. So, because I had too many, that's why we have extra there. And I'm going to need to be packing here in a little bit, so I'm going to go ahead and take a couple of these out and stick them into this one without crossing over, and making sure that I've got enough solution in there to keep those wet. And now I need to dry. Okay, so I'm going to come in, I'm going to get my first one. Again, making sure the edges are not touching. And we're going to do the same. We're going to go the middle up and the inside. We're going to go to the middle down. Okay. We're going to go to the far side next to the incision up. Okay, far side, middle incision down. So you always want to work from the cleanest to the dirtiest, which we want to take the germs away from the remember, in nearest up. I've got extra 4x4s if I need to. Okay. Nearest down. And then we're going to do the whole time I'm making sure those aren't touching the outside. Okay, we're going to do the far side a little bit further out, middle up. Far side, middle down. Oh, it's supposed to be a little bit further out, so that's all right. Far side a little bit further out. Near side just a little bit further out, middle up. Grab one of my dry ones. Okay, and far side, middle down. Okay, now that I've cleaned and dried, I'm going to go ahead and get my culture. So I'm going to go ahead and reach in without crossing over that, pick this up, okay? I'm going to take this out, and because we determined that it was down here, so we're going to put that in there. We're going to kind of, just a little bit of pressure, kind of twist it around, and then I'm going to put that back in my culture tube, okay? And then I'm going to just drop it over here for right now, okay? And I'm going to do glove to glove, skin to skin. We're going to do a medical hand wash. And this one is, we don't have any anymore, so I'm going to go ahead and just pull these closer, just making sure that my 4x4 is, I had enough solution in there that it is wet, and it was, okay? I'm just going to get all this stuff out of the way here. And I'm also going to open up and I'm going to work with my culture here in just a little bit. So I'm going to just kind of push this up here a little ways. And I'm going to go ahead and open up my CTAs. Because what I need to do now, since I've cleaned and dried, is I need to making sure that that stays within so I do realize that that has touched right there on the outside, but what I need to have sterile is actually, I'm going to just grab that right there as I open this up. What I need to have sterile is the CTA part, okay? All right, so go ahead and do my medical hand wash. I'm gonna put on another pair of gloves, and I will date, time, and put my label on there. Here in just a little bit, I want to go ahead and get my patient taken care of. Make sure that I'm not touching my you always want to make sure you have plenty of CTAs in case. Okay. Pick it up. Put my hand in. I'm going to sterile to sterile. Okay, get my glove thumb up before I put this hand in. Check the integrity, push it down, okay? So now what I need to do is I need to make sure I'm going to pick up, because this hand is not going to come back in contact with the wound. So I'm going to pick up one of the CTAs, making sure it does not come in contact with anything. So this part's sterile. And now I can go ahead and get my 4x4. Okay. Make sure you get okay. And then I'm going to go ahead and fluff it out. Like I said, this part is sterile over here, so I'm just going to open up my 4x4. Okay. So it's a moist 4x4, and so again, I've stepped back this way so I can still see my sterile field. And I'm going to use my CTA to kind of help guide my 4x4 down into the wound. So as I'm packing, I want to make sure, you can see I'm kind of pulling it up. I want to make sure I don't pack so tight, but I want to make sure that as I'm packing it, that the 4x4 is not coming in contact with the outside skin. Okay. I don't want to pack it so tight that it doesn't allow my wound to continue to heal or to close. Make sure it's not touching the outside there. Again, I can still see my sterile field. And again, making sure this takes a little bit of time. Try it on the edge, but it's not actually touching on the outside. So I would continue to work. Just right above it till it's covered, and then we continue, you know, maybe because I need to make sure that and I started packing from the top back down because the bottom part was where the other culture part was. Okay, now that I've got that in there, now I need to go ahead and put my contact layer on. So this hand is still sterile. Get my sterile, I'm going to come over and I'm just going to lay that on my wound. And those are no longer sterile. And then I'm going to lay, making sure all of my dressing, and once laid, you want to make it sure it stays, okay? So I'm no longer needing this. I'm going to go ahead and reach over and get my ABD. I can touch the outside. The part that is the blue is the outside. The other part is the part that's going, and I need to make sure that when I set this down that it covers all parts of my, and so once laid, let it stay. I'm going to go ahead and just put this in the trash, do glove to glove, skin to skin. I'm going to do a medical hand wash. I'll put on some clean gloves. I've already got all my sterile stuff already completed. Okay, I'm going to get my tape, and we're going to picture frame. I can find the edge. Okay. I'm going to picture frame. Dressing. And then I'm going to take a 2-inch piece, and I'm going to date, time, and my initials. Okay, today's date is, and the time, and then my initials. Okay, that way the next person knows when the last dressing change was done. And I'm just going to go ahead and put it up here so everybody knows that my patient had that done. And since these are clean, I just did the taping, I'm going to go ahead and get my patient covered up and go ahead and get the rest of my stuff picked up. And then I'm going to have my requisition that they had already made for me. And so it has the patient's name, it has the date of birth, it has a medical record number on it, it has all their identifying information, and then I'm going to put my time, date, my initials, and the location of the where we actually took it. So we took it at the distal end of the open abdominal, and we're going to put that on our label, and we're going to put it into our biohazardous bag with the requisition. And of course then that will get sent down to the lab. Okay. And glove to glove, skin to skin. We're going to do a medical hand wash. And I don't feel like I got anything splashed, but I'm just going to be touching the back side of this. Get that there. Wash my hands from that. Okay, so how are you doing? How was your pain during that time period? Are you having any pain right now? On a pain scale of 0 to 10, 0 being no pain, 10 being the most pain, how would you, okay, no pain, and so we didn't have any pain. I'd be watching my patient during the procedure to see if they have any kind of facial grimacing or anything like that. I'm going to walk around to the other side, and I would remove my pillow. Okay. Put this off to the side, making sure that my patient is comfortable. Okay, are you comfortable? All right, so bed in low position, side rolls up ×2, wheels are locked. Here's your call light, and I'm just going to be right over here, and I'm going to be documenting. So I'm going to do a medical hand wash real quick, and I'm just going to document what we just got through doing there. Okay, so pull my chart up and find where it has on there, and so I'm going to document and report any expected but mainly unexpected things that I found, such as if we thought there was just one spot here but all of a sudden there's two. But anyway, the unexpected, we're going to call the physician, we're going to report it to the charge nurse, we're going to report it to the healthcare team so they know what was the unexpected here. Okay, and we would document all of that. I'm going to document that the need for the wound care, which it said for let's see, my mouse went some down here. So I'm going to document my patient's pain level before, my pain level afterwards. I'm going to be documenting that I position the patient with a pillow up underneath their left side, that we remove the dressing, and if there was any drainage on the outside, what did it look like when we removed the drainage? What was the drainage on the dressing? Was it color, odor, amount, consistency? And that we remove the packing, and if there was any major drainage on there, especially if it was down there where that the culture was taken, was there any extra different kind of drainage on that? So we would make sure whether we're doing all of that. Then I would document what my wound bed looked like. Was there good granulation tissue? Was it red, pink, which would indicate, the pink would indicate good granulation tissue. Was there any necrotic, any slough, yellow drainage? Down there where we took the culture, what did that actually look like? I'm documenting what the surrounding tissue looked like, because we want make sure, because it's a wet to dry, was the edges macerated? Okay, too much moisture on there. And then, so what the wound actually looked like, what the drainage was, what our measurements were. So we would document the length, the width, anterior, middle, and posterior, and then we would document the depth, the anterior, middle, and the posterior part of those. And so we've got those documented, so that way we can compare to see, is it closing, is it, and we should be able to see that in pretty quickly. Again, we've already looked at that. We're going to look at the, like I said, the surrounding tissue. Then we're going to document that we irrigated with 100 mils of normal saline. Again, what kind of solution did we, what did that look like? And then we performed a wet to moist dressing change. Well, so we cleaned and dried with normal saline, and then we took a culture, where we took the location of that culture, and then that we packed with a normal saline moistened 4x4, covered with 4x4s ABD, and we did clock, or we completely put the tape on there, and then we date timed and initialed it. And then how did our patient tolerate all of that? So we already talked about the pain before and after. So once we've finished out documenting all of this stuff, then we're going to close our chart out, and then we're going to come over and we're going to ask our patient, is there anything you need from us? Okay. And again, we've got the bed in low position, side rows up ×2, wheels locked, and your call out's right here. So don't hesitate to call us if you need anything. And I'm going to go ahead and put your stuff here. This extra supplies, I'm going to leave in the patient's room. We already date, time, and initial this, so the next person will need to know if it's within the 24 hours before they use it, okay? And this can just go into the trash. And now if my trash was full, then I would go ahead and put clean gloves on and take that out so that we've got a good clean trash down there. And then, so as I'm leaving, you don't need anything? Okay, well, I'm going to go ahead and here's your tray. And I'm going to do a medical hand wash as I exit the room. And I'm going to take my culture and I will go to go down and make sure I send this off. And so as I was leaving the room, I did my medical hand wash. Okay, if you need anything, holler at us.